Good afternoon, everyone, and Merry Christmas. This morning we held an emergency management team meeting, which was followed by a meeting of the National Cabinet. So we've got a lot to get through today. I'll start with the COVID update. Western Australia has recorded 4 new positive COVID-19 cases. 2 of those are return travellers who are in hotel quarantine after flying in from different locations in Africa. The 2 others are from Queensland, a couple in their 30s who flew in from Brisbane on Sunday night, which was under our low-risk settings at the time, and they were directed to complete 14 days of self-quarantine. Both are double-dose vaccinated. They tested positive after arriving in Western Australia. Both are in self-quarantine. 4 family members, all of whom are vaccinated, have tested negative and are also in self-quarantine for 14 days. A person who visited the home very briefly has also been tested, and I can confirm the result is negative. People who were on the same flight from Brisbane are already subject to testing and quarantine requirements due to pre-existing border arrangements with Queensland. 35 close contacts of the couple have been identified. Of those, 23 have tested negative. So far, 104 casual contacts have been identified. As part of the testing requirements under WA's controlled border arrangements for low-risk arrivals, the couple attended a testing clinic on Monday. As part of their trip to get tested, they stopped by a service station to fill up the car on the way. This is permitted under the directions. The 7-Eleven in Midland is now listed as an exposure site. Police have reviewed CCTV from the service station, which has confirmed they were wearing masks at all times. The man filled up the vehicle while the woman went inside to pay. She only spent 40 seconds in the service station. The advice I've received is that the public health risk is very low. This is obviously good news. However, there is no room for complacency in this current environment while COVID is spreading fast around the rest of the country, which is why everyone should monitor their symptoms and get tested immediately and quarantine if you feel unwell, even if you haven't been to an exposure site. Follow the health advice and stay home if you're unwell. Keep checking in using Safe WA when you're out and continue all the normal COVID-safe behaviours. These growing outbreaks in the eastern states are a major cause for concern. Of most concern is New South Wales, which has today again reached a record number of infections. 3,762 new cases and 2 deaths. This is of course tragic, and the escalation is alarming. We're also witnessing surges in Victoria, Queensland, South Australia, the Northern Territory and Tasmania. We already have strong border arrangements in place with most jurisdictions, which have proven effective in keeping the virus out of our state as best we can. But today I'm announcing further changes. From 12:01 Boxing Day morning, December 26, a hard border will be implemented with both the Northern Territory and Tasmania. This means Tasmania and the Northern Territory will transition from low risk to medium risk jurisdictions, and travel will not be permitted with these jurisdictions unless approved. Any Western Australian who has recently travelled to Tasmania or the Northern Territory is eligible to return under compassionate grounds and must apply through the G2G pass system. We're giving people notice now to get back because from Sunday morning, travel with these jurisdictions will cease unless you are approved to travel under the G2G pass system. Anyone approved to travel must be double-dose vaccinated and will be subject to quarantine and testing requirements. The change will mean the Northern Territory and Tasmania will join Queensland, South Australia and the ACT as medium risk jurisdictions. New South Wales and Victoria will remain an extreme risk jurisdictions. These decisions have not been taken lightly. No one wants to stop families returning home to Western Australia during the festive season. No one. But given the escalating crisis in other parts of Australia and based on updated health advice, we are taking this step to protect Western Australians and stop any spread of the virus into our community.